point that I wanted to make in that presentation was that pediatric arteriovenous malformations differ greatly than adult arteriovenous malformations, mainly because they tend to bleed more often, they tend to be more deeply seated in the brain, and it creates a very difficult challenge in terms of thinking about what to do. Our pediatric AVMs were excluded from some of the larger studies that determined whether or not intervention was important. But because they bleed so often, I think most practitioners believe that some type of treatment of pediatric AVMs is necessary. So we showed that radiosurgery can be very effective treatment for pediatric AVMs. In my presentation, I reviewed two really important studies and introduced some unpublished data as well. The two really important studies that I showed was the International Gamma Knife Radiosurgery Group studies, which was a really wonderful study of over 300 pediatric patients, demonstrating that obliteration of AVMs can be achieved in over 60% of patients. And then a large meta-analysis of over 1,200 patients was also presented. I think the audience was surprised to hear that pediatric patients can indeed tolerate higher doses of radiation, and that it actually requires higher doses of radiation, greater than 22 gray, to be able to achieve obliteration. But our pediatric patients tolerate that well and have a very high rate of favorable outcomes with that regimen. One of the important things that was important to me about giving this talk today is that pediatric radiosurgery is something that I'd like to see a little bit more in meetings like this. And in fact, I'd like to see more indications of radiosurgery in the pediatric age group. So this was wonderful to be able to join my colleagues, Dr. Steve Bronstein and Dr. Aaron Murphy, in presenting this symposium. In many ways, I will say that I have had somewhat of a history of integrating this society and meeting. I was one of the first to bring extracranial radiosurgery to this meeting way back 20 years ago, and introducing spinal radiosurgery as one of the early talks. And so it's great now to also follow that trend to introduce pediatric radiosurgery as well. I've enjoyed a wonderful relationship with the leaders of the organization. Dr. Laura Faracelli and I have been colleagues for over 20 years, and it's great to see her presidency culminate in such a wonderful meeting to be in person as the pandemic still lingers a bit.